Welcome to Chapter the Chief. I'm John Jensen, Chief of Staff at the Veterans Health Administration, and this is the podcast where we make small talk about the largest integrated healthcare system in the country. This week, I'm joined by Dr. Ryan Vega, Chief Officer of the Office of Healthcare Innovation and Learning. We'll talk about VA's global impact through innovations like 3D printing, personal medical devices, and more. Enjoy the show. Well, we'd sure like to welcome Dr. Ryan Vega to the show, and thank you so much for taking the time to be with us today. Really looking forward to hearing what's going on, and anytime we talk about innovation, it's exciting to me. It's also exciting to hear and for you to share what's going on in across our system in the world of innovation. And so, well, before we begin, so why don't you tell us a little bit about yourself and your family, kind of where you're from and those kind of things.
Yeah, John, it's a pleasure to be with you today. Born and raised in New Orleans. So my wife and I both are from the city, but have lived in the Virginia area now almost a decade. I have two children, Kate, who's 4, and Jake, who's 2, both born in Richmond, both born at the hospital that I did my residency at, the VCU Health System. So we sort of consider ourselves Virginians, but really our heart still is in the New Orleans area.
Well, welcome, and you sound like you have a wonderful family. And you still live in the Richmond area?
We live in Alexandria now.
Okay,
we took a leap of faith and moved. We moved up here 2 years ago, and I tell people, I'm surprised my wife didn't leave me. So we had a 4-week-old at the time.
Oh my goodness.
We scrambled to get up here. We didn't understand the housing market in this area. Sold our house in Richmond, moved up here, had to renovate, didn't have a kitchen with a 4-week-old. So it was quite an adventure, but we made it through.
You like to live on the edge, my friend.
That's right.
So we like to start each of the shows off with some couple of questions that are really kind of basic, but really helps the audience to understand who you are and kind of the things that are important to you. And so one of the things we like to ask is a book, TV show, or movie that you're reading or watching that others might be interested in.
Yeah, I was actually a psychology major in college. So I gravitate a little bit to some organizational psychology literature and books, and Adam Grant is somebody that I follow. His new book, I don't know how new it is, but Think Again, fantastic read.
Okay.
And for anyone in healthcare, chapter 7 is called The Vaccine Whisperer. There's a longer title, but it goes into depths about what motivates people to get vaccines. And it's interesting because this was written sort of before some of the challenges with the pandemic, focused particularly on measles in a small city in Quebec. So very fascinating read that talks about motivational interviewing and thinking differently, why we sometimes approach people from a prosecutorial side or from a pastor side. That's the way he sort of frames it, instead of taking a step back and really understanding what's motivating people. So that chapter in particular really hit home. I can't tell you how many conversations I've had with people who won't get vaccinated and probably did exactly what he said not to do. But a really fascinating read.
When people approached them about the vaccine or how they kind of heard about the vaccine, they were approached wrong? Is that what you're saying?
Yeah, so he goes into depths about the number of people each year that die from measles worldwide. Mm-hmm. And in this small town, there was a number of people who refused to get vaccinated from the measles, and they had already had 2 outbreaks. And the story follows this mom who has a premature infant. And towards the end of the hospitalization, she spends an hour with a researcher. And really what transforms her decision is one sentence. And so this individual says, when this person approached me and said, listen, you have a choice and I respect whatever decision you make. And that's not going to change my mind that you are so committed to doing what you think is in the best interest of your children. That changed her mind. So not only did she vaccinate her premature infant, but she vaccinated the rest of her kids. And he really goes into the psychology and the understanding of why people become even more grounded in their beliefs not to get, in this case, vaccinated, even when you present them with all the literature and the data. Right. So it's a fascinating look into the psychology of the individual, and really that one hit home with me, particularly because of what I've experienced over the past 18 months.
Well, I think that's a fascinating book, and I look forward to picking it up and digging deeper into it. So thanks for sharing that. The next question is a unique hobby or something that you do around the house or in your community that others would maybe be surprised about that you do.
Yeah, although I haven't played the instrument in a while. I was in a rock band in high school. I played bass guitar, studied jazz bass, and so have much of a aficionado for music, all music. Some people are surprised at the genres of music that I like and can recite the lyrics word for word. But just have always grown up loving music and played in a band, wrote our own songs, played shows around the city. So something that usually surprises people.
That's actually very surprising. So you still play the bass now?
I do, yeah.
Wow.
Never really was able to get good at the guitar, but bass and percussion instruments always had an affinity for being able to understand and feel that sort of rhythm. So yeah, still play, still love it, still listen to all types of music, and always hone in on the percussion section because that's what I did. So
yeah, I'm actually much the same. I played percussion as well, and so you always hone in onto where the beat's
exactly.
at. So one of the other things I always like to, I guess, hear or understand is a lesson or piece of advice that you've ever received, or something that just really sticks with you that maybe you share with your own team in motivating opportunities, et cetera.
Yeah, a good mentor of mine had a list on his wall. It was called the B list. It was sort of how Gene, I think, approached life. The one that always stuck out to me was be aware of simple answers to complex problems. And that one I really have taken to heart and carried through. And the lesson there for me was that, oftentimes we don't understand the complexity of what's going on, other people's motivations, the reason certain decisions were made or weren't made. And it's really easy for us to criticize and to say, well, why don't you just do this? Or why didn't we just make this decision? And so being aware of all the things that come into play, that sometimes we are all imperfect humans and that we can make mistakes is really important. So that's really stuck with me and I think forces me to ask questions more. Still haven't gotten perfect at it, but to ask questions more about why certain things are the way that they are. And when somebody says, oh, it's just because that's the way we do something, I say, well, that doesn't make sense, right? There's got to be a reason. So part of it is that investigative mind, I think, the scientific inquiry, right? Trying to really understand what's at heart.
Well, it sounds like that's the type of thing that leads you to lead the Office of Innovation and Learning. That's the kind of thing you want to do there, is continue to ask questions and look for, an answer that takes a little time to figure out. I think that's very interesting. So one thing I'd like to understand really from our physician guests are what kind of led you to medicine to start with, and what is your specialty and how did you get down that path?
Yeah, so I'm a hospitalist. I see patients when they're admitted to the hospital. The story is a little bit more of a journey. So I'm the first physician in my family. My dad's an attorney, and I probably was going to law school if not for a number of pretty impactful moments in my life. When I was 12 years old, I was diagnosed with something called Kienbach disease. I used to sort of tell people this as a way to sort of brag about, my knowledge of the human anatomy and the risk. It's avascular necrosis of the lunate bone. Now, what that means is that my bone in my wrist was going through periods of vascularization, revascularization. Basically, my bone was dying and regrowing and dying. And so from the time I was 12, even to this day, I've been a patient. I've been a patient longer than I've been a doc, and maybe it's evening it out now based upon the number of gray hairs I have. 2 major operations. I was in therapy and rehabilitation for years. Did not like medicine at all. Actually hated healthcare. Right? Constantly being at the doctor's office, being told, you can't play this sport, you can't play this sport, we're sorry, you're going to have to live with pain, etc. No interest. I got to college. And my first year, I really didn't have much of a sense of what I wanted to do. Psychology was interesting enough, and I figured, I could go into medicine, I could go into law, I could go teach. It gave me enough flexibility. And then my sophomore year, October 15th, LSU football was doing pretty well. We still had Nick Saban, so I'm still sore about that. A pledge brother of mine, we were in the backyard. And so you have to put this into context. You're invincible when you're a sophomore in college. Bad things don't happen. So we leave formal dinner, which is when all the actives and the pledges come together. We have dinner. It's, a fun ritual, rite of passage for the pledges. We're in the backyard. It's a beautiful fall day. Our house was on the lake. We built a zip line. Bunch of kids goofing around. And Jason Whittle, being the guy that he was, Jason's going to go first, right? He's going to test the line out, so to speak. Well, the line broke. And unfortunately, the way that Jason fell, the first thing that he hit was his head. 2 days later, we lost Jason. And so you go from this invincibility and having not a care in the world to not knowing your place, what's going to happen, and witnessing it, you sort of, have this reaction. It affected all of us differently. But for me, for whatever reason, it made me say that I'm going to focus on something and that's it, right? I'm not going to look back. And there was this perhaps calling to saying, I had this experience in healthcare, that's what I'm going to do. For right or wrong, it sort of said that's what I'm going to do. I got to medical school. I didn't just get there. I mean, I worked my butt off to get there. First 2 years, I struggled. And I share this story with a lot of the students that asked me, hey, how did you get to where you are? I barely passed a class my sophomore year, so barely passed a class, and didn't really find myself until I was in my third and fourth year, around patients, really being able to relate to people. Perhaps I understood where they came from and understood some of their struggles. And then it was time to decide, what are you going to do in residency? So I said, I'm going to go be a physical medicine and rehab doc. I didn't know what I wanted to do. I really wasn't that excited about it, but I said, I understand that world, being in rehab so long, that made sense. Well, thankfully, I had a good mentor sit me down in December. So I'm already interviewing for these residency positions. George Karam sits me down and says, look, I really believe you need to go in this direction. I think you need to really consider going in a different direction. He laid out his reasons why, and I took a leap of faith. I trusted him, that he had the foresight. And so pulled my applications and then found my way to Richmond, did my internal medicine training, and then was fortunate enough to have another of opportunities. So that was really my foray into medicine. It wasn't planned. It wasn't something that I think was clearly laid out for me. But really two important lessons that I look back now that shaped. And what was interesting is it's always easier to reflect now. Some then people ask, well, how'd you get to where you are here? I had more of those types of experiences that really would begin to shape how I approached my job, my personal life, et cetera. And they're all, stories that we all have. They're stories of loss, they're stories of grief, but they're stories that have a profound impact on who we are as an individual.
Well, for sure. Wow, what a journey. And just happenstance, circumstances that lead to things. So that's very interesting. So you mentioned that you went to Richmond. Did you train at the VA?
I did. So one of the things, my first day as an intern, I was on acute care service. I was in the hospital in the Richmond VA Medical Center. That was my first day as an intern. Scared as all heck. But I had eventually an opportunity to serve as a VA chief resident for quality and safety. Another little interesting story. I really didn't know what I wanted to do in residency. So I've kind of had this common theme where I don't really know what I want to do. Right. And I thought, by looking at all the people that were in these high-level administrative roles, I said, well, I probably can do that well. They were all chief medical residents. I didn't get selected as a chief. And that was, to me, like, I really don't know what I want to do. A month goes by, and our dean of graduate medical education pulls me in a room, and jokingly, but not jokingly, she says, you don't know what you're going to do next year, do you, right? I said, no, Mary Alice, I really don't. I think you need to consider this role in the VA. And that was a defining moment for me, because I took that job not knowing anything about what I was going to be introduced to. And from that moment on, I've been attached and passionate about the mission. So it's funny how you don't get what you think you want, and you find these new opportunities that come to you, and that really begins to define your career. So from the moment I was a chief resident, I was bought into the mission, and I've been with the VA since.
Well, we thank you for being a part of the VA and for finding that place with us. And so now you lead the Office of Innovation and Learning. So maybe you could describe for our audience kind of how you got into that position, and then maybe even describe what that office is and what it does every single day.
Yeah, the long short of the story is I was doing a lot of quality and safety work at the VCU Health System and at the Richmond VA Medical Center. One of the projects we were doing was we were developing an application in the back end of Cerner that augmented, really it helped providers with the handoffs, transitions of care, standardize it. So we were doing some innovation work, we were doing some informatics work and quality and safety. And so we were spreading this across the health system, and it was sort of gaining traction and awareness from other health systems. They were kind of coming and visiting and seeing, hey, what are you all up to? I ended up meeting some people at central office who took notice of, we were on our so-called journey to high reliability. And so they took notice of what we were doing. I met them and the work became interested. But I wasn't searching for a new role. I had just gotten in to be the chief of quality at the Richmond VA Medical Center. And unfortunately, Gene Peterson, who I'd sort of mentioned earlier, at that time was a true mentor and a friend, got diagnosed with cancer, a rare form of osteosarcoma of bone cancer. And from the time of diagnosis to the time of his passing was about 3 months. Wow. So I remember, I sort of tell people I had my Tuesdays with Maury time with Gene. I'd spent a lot of time in the hospital. We talked about life, really, and what stuck out to me at that period of time was, I'd always been focused on like the next thing, the position. Gene he had a great sense of humor. He'd say like, Ryan, the next thing for me is the great unknown. I mean, so really imparting this idea that it's all about what's in front of you. And it's all about how you take what's in front of you, what you can control and make an impact. And so I kind of was looking at opportunities from that period of time when we lost Gene and saying, I think I can make a difference, but where are those? And that really led into work in the diffusion of excellence space. And then I just kind of was on for the ride. I mean, a lot of it was taking some risk, but VA over the past year has really been formalizing its innovation infrastructure. And it's maturing in a way that when I tell people what VA is doing, most of the time they go, I don't believe you. And that's fine, but we're actually doing this. And so the Office of Healthcare Innovation and Learning is really the formulation of years of leaders like yourself and predecessors that came before us, trying to figure out how to make the right infrastructure to do mission-driven innovation. How do we get cutting-edge solutions into the hands of our providers and veterans in a way that we never even imagined before? And so the office brings together our simulation network and our Sim Center down in Orlando, the traditional innovation team, the innovation ecosystem, and our new Center for Care and Payment Innovation, which is bringing an incredible amount of resources and assets together. And in my mind, I think will help transform the way that veterans experience and receive care.
And so it creates an opportunity for innovation by ensuring the resources are there for them to get to that.
Right. Innovation happens everywhere, right? Innovation happens when you figure out a better way to drive to work, in essence, right? My favorite description of innovation, I recently just heard this from someone, is it's taking something broken and making it beautiful. And there's lots of definitions for innovation. Innovation is going on across this organization at every corner. What VA has figured out a way to do is to systematically operationalize that. It's to give the individual on the front line an opportunity so that their work doesn't just change and save the lives of veterans at one VA, but in fact at hospitals all across America, which I think is just this incredible success story about how VA is not just moving the needle for healthcare in VA, but for healthcare in America. And in some instances, when you look at our pandemic response and the work around additive manufacturing, a global impact. And that, John, that takes leadership, it takes commitment, and it takes everyone coming together and being driven by a mission. Not sort of saying, I'm doing this because I'm trying to make money or because I want to be famous. That type of transformation doesn't just happen. And so I think that's really the story of innovation in VA. It's this coming together of the front line of leadership and being laser focused on the mission. And we're seeing just incredibly beautiful things created from things that others may look at and say we're broken.
Yeah, and it really showcases what we've done in the pandemic as far as becoming a learning organization and you leading so much of that from the forefront. And one of the things that we worked on a year plus ago in the pandemic was 3D imaging and really how we can create so many different things through 3D imaging. And we were able to do that as a network of a system unlike any other kind of healthcare system in America. So maybe you could describe a little bit of that and kind of what led to some of those things that are happening or were happening in the pandemic and even up until today.
Yeah, you articulated that so well about how we did it as a network. I always tell people our competitive advantage, and I will put any health system against us, when we leverage our ability to operate at scale as an integrated system and the trust of the veteran, there's not a single health system in the world that can compete with us. And that's what was formulating, and it really goes back almost a decade of the introduction of 3D printing into the healthcare space. But really, it was the network coming together in 2017 and just an incredible amount of effort in the field to bring together, to share the knowledge, the learning, the assets, the resources, how to do this better, coming together and operating as a system that positioned us to do what we did during the pandemic. This wasn't because you all came to us and said, here's a ton of money, go figure this out. We had the infrastructure in place and years of people's blood, sweat, and tears to make that happen. And so what really was the catalyst to this was actually the FDA and the NIH saying, we've got a ton of people around the world submitting design files to produce a swab because they can't get them, to produce a respiratory mask or an N95 because they can't get them. We have no way of knowing if these things are safe or effective, and we don't even know how to test these things. So they saw the VA's infrastructure and said, yes, you have a fourth mission to be the backstop, but that fourth mission extends to perhaps actually helping globally individuals understand what's safe and effective so they can get back on the front lines and take care of patients. And that's exactly what the team did. Begin testing all of these different devices and design files against standards that didn't exist by creating them and then sharing that globally. You saw millions of swabs produced based upon data that came from validation studies in the VA. You saw a number of respirator masses. You saw our own inventions that now, I don't have it with me, but it's a respirator hood that's being distributed globally. So when you think of VA's impact on just the American health system, during the pandemic, we were impacting the global health system, and we still are. That to me is just an incredible success story that didn't just happen. But the brilliant thing about additive manufacturing that I always tell people is, if you're writing a paper on your computer, you just see that paper on the doc image, you press print, and all the printer does is take a layer of ink and it replicates what you see on the screen. 3D printing is no different. I mean, you see this 3D image, it's just printing it layer by layer by layer. And so what we're seeing is that is going to allow us to do things that we never imagined in the manufacturing space, whether it is taking a patient's MRI and actually recreating what we see. And literally, this is one of the first anatomical models we created. So this is the vasculature, this is the blood vessels of a patient's liver. Now, this is obviously shrunken down, but this was just taking that from a CT scan or an MRI and 3D printing it. And now I can hold it in my hand, which, if a picture's worth 1,000 words, it's kind of hard to think about what that's worth. It's allowing us to create customized medical solutions. So instead of telling the veteran, look, choose between a small, medium, or large, what is it that you want to do? You want to play tennis again? Let's create the orthotic or the prosthetic for you at a fraction of the cost and at the point of care. And then the future is going to be biofabrication, where in our lifetime, we are going to see organs and tissue and skeletal parts be fabricated from 3D printing. And VA, I think, playing a leading role in that globally is something you can hear I'm incredibly proud of, but it's making a difference in the lives of veterans, and it's also moving healthcare globally forward. So it's one of our best success stories.
One of the first things that I saw on the 3D printing part was some surgical planning that was done in Seattle and some parts that were, kind of printed from that in order to do surgical planning. So maybe you could talk about that just a little bit, because I think that's really exciting, because you really talk about safety at that point, and you really talk about the ability for our clinicians to really hold those things in their hand before they go into surgery. So maybe you could talk about that just a bit.
Yeah, the story of how we started to incorporate that, I think, is one that resonates with most people. So you have a radiologist in a room, and this is a true story, and you have this complex procedure that needs to be performed to remove a head and neck cancer. And the docs come down and they're preparing for surgery, and the radiologist recognizes they keep doing this. And so surgeons have to think in a three-dimensional world before they get into the operating room. And so they're looking at the image and they're wanting to grab it, they're wanting to rotate it. And you can imagine even having VR or holographic, you're not holding the physical object. And so that radiologist just sort of said, why don't we just print the organ? And that radiologist is Beth Ripley, who leads this work. But that was the first foray. And so the model that you saw was a tumor, a kidney tumor. Yep. And what they did was they were able to recreate the patient's actual anatomy, localize where the tumor was, and the surgeons now could hold the anatomy before they get into the operating room and say, okay, this vessel is going to be compromised, this blood flow, we may damage it, and then we're going to have a world of trouble. There's a nerve here. They were able to do things that they can only do when they get into the operating room, before they ever got into the operating room. And so now what we're seeing as we build this network and this advanced manufacturing network across the organization is the team is now close to having FDA approval for these types of models to use in clinical care. And what's brilliant about their strategy is they're not saying, let's have these technology everywhere. That's going to be too much burden on the system. Let's have it strategically at places that can do this. And then let's give clinicians the ability to go into electronic medical record and just order it, just like you would a test. And so the first 3 of these have been done. Charleston consulting Seattle. And Seattle is producing these replicas, near exact replicas of the patient heart. And the surgeons in Charleston are using that for what we call left atrial appendage closure. So a little flap on the heart can be a very complex procedure. And so now they want to use this before they go into the operating room for every procedure that they do. And what's incredible is now we're getting requests from our academic affiliates saying, hey, can VA produce these models for us as well? You all have figured out how to turn this around very quickly, and you've got this distributed network where you can consult. And so we're having to learn and move slow and methodical. But we believe, and I think if you talk to most surgeons, for a number of cases, it's going to become standard of care that you recreate the model before they ever go into the operating room.
That's fantastic. So many things that your office touches on and the great innovations that happen throughout our system. And it's really showcases in a learning organization and in our HRO journey into deference to expertise and so many other things that you get to touch every single day. And you talked about 3D printing. And so we talked about 3D printing a lot. It's so exciting. And when you ever can hold something like that in your hand, it really brings it home about how we were able to care for veterans in a whole different way than we ever did before. So you can talk maybe some other things that you're working on in an innovation space, not 3D printing.
Yeah, absolutely. So I brought props. This is a wristband. This is from the Pride in All Who Served course. And so we'll take a little departure from technology. This is a 10-week course that some folks on the front line created specifically to address the challenges that LGBTQ veterans face in navigating the healthcare system. And I always tell people this as a doc. I don't remember any time in medical school or any time in residency understanding how to help these individuals navigate, right? So, you have a transgender male or female and you have to have a conversation about breast cancer screening or prostate cancer screening. So most docs, we get uncomfortable. We don't know what to do. So we probably ignore it. And we know when we look at rates of suicide, when we look at challenges in equity and disparities, that this is a population that is significantly impacted. And so these individuals said, well, what if we created a group course that helped clinicians, providers, and these patients collectively navigate the system? And what was remarkable, and the reason I bring this particular innovation up, is because this is one that spread so rapidly by veteran demand. We were having veterans hear about this. These were veterans that had no interest in coming to the VA and probably weren't going any other health systems as well, show up at the VA and say, sir, madam, where's your Pride course? And people going, I don't know what you're talking about. And they said, well, I demand that it comes here. So we saw this go from 3 sites to 47 in under a year, surely by veteran demand. And we are seeing reduction on validated scales around depression and anxiety. But John, when you read the veteran testimonies, one veteran, anonymous veteran said, I had attempted suicide twice and was likely going to be successful the next time until I found this group, until I felt accepted and understood that VA was there for me to help me understand and navigate the challenges I was having. So, if that one program saved that one life, I think we're looking at success. And this is not something technology advanced. It seems somewhat simplistic in nature. But packaging it together in the way that they did was innovative because it was about group modeling. It was about bringing people together. It was creating a course that we could continue to iterate. And that's something I think that has just been enormously successful in us helping to address the inequities of care. And we're seeing this type of thing be adopted across all American health systems. They're recognizing how VA was a leader again on this innovative front and saying, how do we bring that type of work to our hospitals?
It's almost innovative in innovation.
Exactly.
It's not what I would normally think about as innovation, but really about the way that you're reaching a group that was never maybe reached out to before.
Absolutely.
And ensuring their care, and we're caring for them as we have promised to do. Yeah. That's amazing.
Yeah, I tell people that the mission of the VA is to care for. It's not to provide health care. It's to care for. And that's fundamentally different. And I think when you look at solutions like Pride, we're caring for people.
Yeah, it's not, healthcare is a component of that care. Yeah. So well put. So what's on the horizon? What are we looking for? What's the office up to today that you can share? Surprise us.
So I'm gonna bring a mat, and this I think is the future of healthcare. So this mat looks very simplistic. This mat is really a thermometer for the foot. The veteran stands on this mat 15, 20 seconds, a couple of times a week. And what it's helping us do is detect their, I would call it risk, and really the ability to intervene before they develop a diabetic ulcer. This technology, we know from studies within VA and outside of VA, is reducing veteran amputations, it's saving lives, and it's reducing admissions, the need for operations, all those things. I bring this mat not because this one project I think is what is all that's coming. I think what you are seeing by the introduction of this mat is the fundamental shift in where healthcare is going. This mat sits in the veteran's home when they're brushing their teeth. It's part of their daily routine. It's not asking them to do more. It's allowing us to intervene 5 or 6 weeks before the human eye could ever detect an ulcer. It's moving care further upstream in terms of prevention, and it's moving care outside of the walls of the traditional hospital. I think this is the next evolution. This is the virtual care, the digital care revolution. I do think we are on the cutting edge of it. I think we've got decades of experience in how to do this well from a population health standpoint. But this is the future of medicine. It's the idea that your phone knows far more about you as an individual than the doctor does. It's the idea that we can reach people in the comfort of their homes. We can do more in the veteran's home to care for them, to prevent them from ever becoming sick. And so I think this, Matt, is one of the many projects that signifies what the future is going to be like. CMS just released ruling around more dialysis at home and the ability to pay for it. So you're going to see more dialysis be delivered in the home. You're going to see less need for clinics. And think about what that means. It's not just about the safety and the comfort. One of the biggest challenges for individuals receiving dialysis is transportation. Well, if it's just in their home and it's easy for them to use, we can begin to eliminate not just barriers to care, but we can eliminate the inequities and the accessibility to certain solutions. So I think this is where we're going. We're going to see more digital innovation. We're going to see more connected devices, whether it's wearables, your phone, smart mats, the ability to provide services we never thought possible in the home. And so the hospital is going to look different because it's not just going to be a brick and mortar place where physicians work. It's going to be in your home, in your car, on your phone, and it's going to be an ecosystem. Now there's risk and there's challenges, but that's where we're going.
That's amazing. Truly amazing. I really appreciate your passion for it as well. And so if there's clinicians or staff in hospitals that have something that they're wanting to like develop further, have discussions about how would they do that?
We have a number of programs they can apply for, some of them to get funding, some of them to help them get just the experience and the knowledge. So we have a fellowship program that they can apply to. We've got a number of fellows coming in. I will share their story because I think this is just profound. Georgia Kingba, who was one of our senior innovation fellows or entrepreneur in residences last year, vascular surgeon at the DCVA Medical Center, developed a patented device. It's a 3D printed guide wire retraction, allows him to do surgery more efficiently and effectively. So motivated by his experience, he just commissioned as a lieutenant commander in the Navy. Just got sworn at the DCVA Medical Center so he can now start working at Walter Reed and bringing some of his technology to active duty service members. So we have pathways like that where they can apply for fellowships. They can apply for funding in our Spark Seed Spread program. The easiest thing to do is just go to innovation.va.gov and they can find different pathways, different opportunities, connect with us. And I think there's so much opportunity right now and there's so much going on that half of the battle, John, sometimes is just saying, hey, we know someone else doing that. Right. And making those connections becomes a network that builds upon its own.
Yeah, and then it propels it further and faster because there's more kind of thought police in there, thought developers that are in there kind of developing the next stage that's going to happen.
Immersive technology. They just started an immersive technology network. it is exploding. We're seeing hospitals across the country come together now to use augmented reality and virtual reality for physical therapy in the home, for pain treatment, for exposure therapy, for PTSD. So, the network came together and then it exploded. And that's the beauty of the VA.
Yeah, fantastic. And I just truly appreciate your passion. Well, we come to the end of our time. So I'd like to leave you with an opportunity with any closing thoughts or comments.
We have, I think, and where we sit is at a fundamentally important transition point in how we believe healthcare should be delivered. I think the pandemic exposed a lot of vulnerability. And I think the challenge is not to go back to the way things were. And it's hard. It's hard to continue to fight. It's hard to continue to be resilient. But each and every day that I come to work, I am inspired by the work that is happening in our front lines. And I think it's important for people to remember that there is so much opportunity to be part of changing and saving the lives of those that served us. That motivation enough drives me. It helps me become resilient. Doesn't make it any easier. But folks out there should realize the system that they are a part of is helping to redefine what healthcare would look like. And I know that they drive by hospitals and health systems that are probably sometimes easier to work for, but none of those are making the impact we are. And so if anything gets us through this and helps us continue to push forward, it's that mission and it's that idea that I think we are helping to redefine what medicine will look like and feel like.
And we need everybody on board to be able to get to that point. I really like what you said about care and not just healthcare. It's healthcare is a part of care. And I'm going to take that back and continue to use that. So Dr. Vegas, thank you so much for being with us today, and look forward to hearing about anything new out there in the future.
We'll keep you informed.
Thanks. Yeah. And thank you everybody for being with us.
I hope you enjoyed today's conversation. A huge thank you to all of you for listening, to Dr. Vega for his time, and our broadcast and production team for their support. See you next time.